Δίπλα μας έχουμε την καθηγήτρια κυρία Ilana Kaplan. Η κυρία Kaplan μίλησε σήμερα για ένα πολύ σημαντικό θέμα. Τις κακοήθεις αλλοιώσεις του στόματος που μπορεί να μιμούνται τις καλοήθεις και το αντίστροφο. Καταλαβαίνουμε λοιπόν πόσο σημαντική είναι η διαφορική διάγνωση σε τέτοιες περιπτώσεις. Good evening, Mrs. Kaplan. Thank you for this interview. The title of your presentation was The Parade of the Mimickers or Wolf in a Sheep's Skin. This is a very vivid description. So tell us about the problems when it comes to the differential diagnosis of oral lesions. What are the most common types of diseases and tumors affecting the oral cavity?
Okay, the majority of the diseases that affect the oral cavity are viral or bacterial or derived from local trauma. Only a minority are cancer or pre-cancer. The problem is that they don't, most of the cases you cannot differentiate them with certainty just from the way they look clinically. Very often we would need to do a biopsy to confirm whether it is cancer or not. But most of the other viral bacterial lesions don't need a biopsy. There are other ways to diagnose them.
How can oral cancer be recognized?
Okay, there are several signs that will raise the suspicion. For example, an ulcer that doesn't heal within 2 or 3 weeks, or if it has raised margins, or if it is fixed to the tissue underneath. These are signs that will tell me it's suspicious. I cannot, however, do a final diagnosis without a biopsy. So these signs will tell me, okay, we need a biopsy and go on from there.
Does it have typical signs or symptoms?
Well, not symptoms usually. In contrary to what people think, cancer is not painful in the early stages. As I said again, there are some suspicion signs, but not typical in the sense that I can look at it and say, okay, this is cancer or not cancer with any amount of certainty.
Is oral cancer hereditary? What are the causes?
Oral cancer is not hereditary in the majority of cases. Some causes that we know about are smoking, heavy smoking, tobacco use, and also a virus called papillomavirus, which also can cause cancer of the... stop for a minute. Cancer...
You can take a breath and continue.
Okay. Papillomavirus is a virus known that can cause cancer, gynecological cancer, but also in some cases it's responsible for oral cancer. But there are also some cases where we don't have a reason or a factor that we can for certain say this is what caused the cancer. Sometimes it's just a lottery, it's a chance.
Can it be prevented, and how important is early detection?
Okay, yes, it can be prevented if people recognize the early stage, the pre-cancer. So you need a specialist that knows how to look at the oral mucosa and recognize the signs of early stage or pre-cancer. Early detection is very important because when it's detected late, the chances of cure are very small, whereas if it's detected very early, they are very high. So it's like a difference between 10% cure and 90% cure, early to late stages.
What tests can help in recognition of oral cancer?
Okay, the oral cavity is easily visible, unlike cancer of the lung or other organs. So visual inspection, just somebody taking a mirror and looking into the oral cavity, is the most efficient test. And this can be done by your dentist or by an oral surgeon or by even an oral hygienist if she's trained to recognize this. It's easy, it's visible. You open your mouth and it's there.
What specialist can a patient address to?
Okay, the people who are trained specifically to recognize oral cancer are oral surgeons and oral medicine specialists. Dentists should also get some idea when they are training as dentists, but it's not a very strong subject in dental school. So best is oral surgeons or oral medicine specialists.
How often should a patient be checked?
Well, the protocol says at least once every 6 months. So this is about the time you go to your dentist if you're good. Once in 6 months is a good time interval that if anything happens, it can be recognized in time. So once every 6 months is the good answer.